let's go to number 4, dosing, too much or too little. Now, I will always tell you when you get a new laser, start with what the company recommends because they've had input from lots of people telling them, hey, I did this and this happened. I did this and this happened. But there's such a huge caveat of how we can get better results, hence the course, right? So things like edema. The company doesn't know what's going on in your dog, your patient today, right? They give you general guidelines. One of the rules for me is you treat it until it's done. And we have a whole lecture on treating till it's done. But let's talk about edema for a second. If my dog's leg comes in and they're this big, and I know it's supposed to be this big, and I set my machine, and it goes from here to here, and my machine goes ding, but it was still getting smaller, I can turn it up a little bit or turn it on again and see if it keeps getting smaller. On the other hand, if it goes from this big and it's this big back to normal and the machine's still on, shut it off. We don't need that extra energy, right? Treat it till it's done. Treat your patient, not your textbook. Muscles, same thing. We need to know what normal muscle feels like so we know what abnormal muscle feels like so that we know what normal muscle feels like after we treat it. Okay, here's one for you. Too much hurts. Remember I said I'm a maverick? Well, I've used almost every laser out there. And recently I said, I wonder what too much feels like. So I took my wrist and I thought, okay, I'm using wavelengths that may or may not be able to go into my blood. So this should be really cool. And I'm going to see what happens if I leave my laser on too long. It hurt, not from heat. My tissue was not hot, and yet it ached for just over a day. I'm like, huh, I wonder what happens with our patients if they feel that too. So all kinds of learning.